Hello everyone. Do all men with the prostate problems need surgery? Definitely not. But waiting too long can sometimes do more harm than good. Today, let's break the confusion and talk about when prostate surgery becomes necessary and when it is better to wait. Hi, I'm Dr. Arif Akhtar, and let's explore the decision-making process in a very simple scientific terms. First, not all prostate issues are the same. We have to look into three different issues of the prostate. One is the non-cancerous benign enlargement of the prostate, very common in men over 50 years of age. The second one is the prostate cancer, which is a cancerous condition that may or may not need surgery depending upon the stage and the aggressiveness. Now, the symptoms of the prostate problems includes slow or the weak urine, frequent urination at night, incomplete filling of bladder emptying, straining to urinate. So, not every symptoms means that you need surgery. So, most of men with mild to moderate enlargement of the prostate, which is non-cancerous, will start with the alpha blocker or 5-alpha reductase inhibitor. They can reduce the symptoms by up to 30-50% or delay or even avoid surgery in many instances. Now, studies have been published, like if I quote mTOPS trial, shows that the combination therapy works well, especially if the size of the prostate is close to 40 grams in size or more than that. But medication may not work forever. If your symptoms persist or worsens, it is a time to consider to look for an option of surgery. Here are the red flags when the surgery is recommended. Recurrent urinary tract retention despite catheterizations. If there is an associated bladder stone due to incomplete emptying of the bladder. If you have any recurrent episode of UTI because of stagnant urine. If there is a chances that the kidney are swollen and there is a chances of the kidney damage. Failed medication therapy with poor quality of life and failed compliance. A AUA guideline emphasizes that surgery when these complications appears or lifestyle is heavily affected is recommended. Also, men with the prostate cancer, especially high-grade cancers in which the score is more than 7 or equal to 7, rising PSA levels, or who have an organ-confined disease should consider radical prostate surgery or other targeted treatment. Now, let's break down modern surgical options based on the size of the prostate, your health and your goal. Now, there are multiple ways of skinning a cat. Like transurethral resection of the prostate, which is the gold standard for the prostate, less than 80 grams. Success rate is way more than 90% in the symptoms relief. Risk are the bleeding and retrograde ejaculations. Now there are laser treatment like HoLEP, best for a larger size of the prostate, which is more than 80 grams. Laser based, minimal chances of bleeding. Durable relief, short catheter time, and more than 95% long-term success rate. We also do open or laparoscopic or robotic simple prostatectomy. Now, there are multiple minimally invasive therapy like urolith, resons, which are very selective for those avoiding major surgeries or young patients. Not for all patients, there are effective indications, not as effective for the large prostate, and these are office-based minimal. A 2023 study was published where the HoLEP and the robotic simple prostatectomy offers superior outcome for a very large prostate with fewer complication rate. But surgery is not always the first step. You may wait if the symptoms are mild and they are manageable. PSA is stable, no evidence of cancer, no damage to the kidney or the bladder, and you are responding well to the medications and the compliance is good. But watchful waiting must be active. Regular PSA testing, ultrasound, uroflowmetry, and symptomatic scoring will definitely help us in monitoring your symptoms. Now, prostate surgery is a life-changing, but only when done for the right reasons at the right time. If you or your loved one are facing any prostate-related urinary symptoms, don't guess, consult a urologist for a customized plan and options. Don't forget that not all prostate-related symptoms require surgery. These are some of the patients who are getting worsened, who are having bothersome lungs or lower urinary tract symptoms, or is completely devastated by the repeated episode of urinary tract infections. Thanks.